Have you ever delayed your dental visit because you're scared or anxious? Then you're not alone. Dental anxiety affects millions of people around the world. But here's the truth, if you delay the dental visit, it's not only going to affect your teeth, but it's also going to affect your overall health and confidence. Hi, I am your super dentist, and today's topic is the most common thing that we all have gone through in our life, and that is dental anxiety. Now, in this video, I am going to talk about what it is, why it happens, and 6 simple ways to overcome it. So, stick with me till the end. So, what is dental anxiety, fear, or phobia? Now, we might have heard these words used interchangeably, but these are 3 different phenomena. Now, anxiety is a response towards unknown stimulus. We are into a new place, or it's a new environment or new experience, then we feel anxious. But what is fear? Fear is a response towards known stimulus. We have had a past experience, or we have heard it from somewhere, so we know this particular thing, and that is what is causing fear. And phobia is excessive and irrational fear towards certain stimulus, and in this case dentistry, and that's why it's called as dentophobia. What are the causes for dental anxiety and fear? There can be two reasons behind it. One is external causes and one is internal causes. Now, what are external causes? Maybe you have had a very bad past dental experience, either traumatic or painful extractions or a painful procedure, that can be the cause. Or you might have heard stories, scary stories from your family members, relatives, or friends who have narrated some horrible stories of or you might have heard rumors, or you have the fear towards needle or certain stimulus. Now, the internal causes can be genetic predisposition or the personality traits. Now, already you are anxious, and that also can seep into the the dental visit. So, I know it sounds complicated, but the fact is psychology is a complex subject, and the phenomenon of anxiety and fear has been studied across a lot of years. So, what are the consequences if you don't deal with it? When you delay the dental issues are going to increase, and with the increased problem, it can lead to more painful treatments, and the more painful treatment is going to increase your fear eventually. So, it is a vicious cycle. It is going to affect your fear more and more. So, you might ask, does it affect my life overall? Definitely it does. Now, having a teeth or gum infection can lead to general health issue as well, and having a painful teeth leads to difficulty in chewing the food, which can lead to digestion issues, and having a your front teeth broken or infected can affect your speech as well. Now, overall, if you have a bad smile or a bad breath, it can affect your personal relationship as well as your confidence too. Hence, it is important that you overcome this dental fear and improve your not only your oral health but also the quality of life. Here I am going to give you 6 simple steps on how to manage your anxiety. The first one being, go and greet your dentist. Now, this might sound very vague, but having a casual meet with your dentist, not a consultation or a treatment, just go visit the place, see the clinic. So, as I told, when you know the place, it will reduce your anxiety. The second thing is asking questions. Now, you need to ask your dentist the questions about the, be it about the oral condition or about the procedure that you have to go through. So, knowing the procedures can reduce the anxiety as well. Now, the third thing is about enhancing control. Now, enhancing control means most of the time we have that fear of losing control. So, two techniques that we usually use under enhancing control is tell, show, do technique and the modeling technique. Now what is tell, show, do? Tell, show, do is a dentist will show tell you about the procedure, what has to what has to be done, and he will show you it on a model and do it exactly the way it was told. So that will increase your trust and the confidence in the dentist. Now what is modeling? Modeling is the procedure will be shown in a maybe in a audio visual manner or on a patient, wherein you can see what is what procedure is going on, so that you clear your doubt about the procedure. And the fourth thing is the distraction. Now having distraction, meaning you love to hear songs or audio visual distraction by distracting yourself by seeing any visual. Or and the fifth thing is exposure therapy. Now this is one of my favorites. Why? Because it's also called as exposure or desensitization. Now this is where the treatment is spread across multiple appointments. Now in the initial phase it can be only the consultation, and the second appointment may be x-rays, and third appointments might be small fillings or cleaning. So basically what we are doing is we are increasing the stimulus, that is from the least feared procedure, and we gradually as the appointments goes on, we keep on introducing new things, so that the patient gains trust as well as their fear comes down. And the final and the last very important thing is positive reinforcement. Now positive reinforcement can be done from the dentist side, from my side too. When I tell my patients, when I pat my patient or tell, oh, it's you have been very good throughout the procedure, now that builds confidence in. And another thing is when we gift ourselves, for example after the procedure you have an ice cream or you gift yourself something, telling that yes, you have done really well. Now that helps in improving the confidence and reducing the fear. If this video was very useful, please like and subscribe. And if you know anyone going through anxiety or dental fear, please share this video to them. And if you have any doubts, drop in the comments below. Thank you.